Hi, today I'll be doing a presentation on paediatric asthma and how it affects children. We will specifically focus on a town in Victoria called Bendigo. I hope you enjoy and I hope you learn a lot. Thank you. Bendigo is a regional city, a 2-hour drive away from Melbourne CBD. It has a population of 124,000 people, with 18% of the population being children aged between 0 and 14. Bendigo is a population made up of urban and semi-rural areas. Childhood health outcomes are influenced by healthcare access, environment, and socioeconomic factors. Asthma is the current leading chronic condition for children aged 0 to 14 within Australia. Asthma is characterised by chronic airway inflammation, wheeze, and breathlessness. Asthma is still the leading cause of hospitalisation in children. Within Victoria, there is a higher prevalence of asthma-related emergencies, especially within regional areas compared to metropolitan. This is due to pollen, smoke, and dust. Asthma has a direct effect on health, economic, and social impacts. In regional towns like Bendigo, families face various challenges, including lack of specialised care, increased wait times, delayed results, and inconsistency in care plans. Bendigo experiences seasonal issues like thunderstorm asthma. Thunderstorm asthma is an epidemic whereby there is an extremely high levels of grass pollen in the air in conjunction with thunderstorm conditions. Due to the consequences and prevalence of paediatric asthma, it is an issue that needs to be addressed within a community with a specific education plan. The education plan will aim to educate families, carers, and school staff on how to manage paediatric asthma and aim to prevent it. A short-term impact of paediatric asthma is experiencing frequent exacerbations, causing coughing, wheezing, and breathlessness, leading to reduced physical activity, sleep disturbances, and missing school. As a result of this means for families increased doctor visits, inconsistency in routines, emotional distress, and missed work for parents to take work off to look after children. Medium-term impacts. Poorly managed asthma causes frequent hospitalisation and increase in reliance on medication like bronchodilators, which impacts quality of life. Consistent absences from school due to frequent hospitalisation and illness is likely to impact social connections and education, impacting building foundational friendships and solidating learning. Increased medication requirements means there is more room for error when administering medication. Increased hospitalization leads to increased medical bills and reduced work, causing more of a financial strain on families, increasing inequalities within regional communities. Long term, poorly managed and uncontrolled asthma can continue to persist through adolescence and adulthood. This can cause chronic conditions like respiratory impairment, impact on lung growth, and which leads to an increased risk of developing chronic obstructive pulmonary disorder. Asthma long-term can reduce participation in physical activity, causing other issues like weight gain, heart conditions, and type 2 diabetes. Children living with asthma long-term can develop anxiety and reduce self-confidence, which will shape long-term health behaviours. Within the community, this increases health system burden and reduced workforce participation and productivity. Two components of the Ottawa Charter that are relevant to paediatric asthma are strengthen community action and develop personal skills. For a regional town like Bendigo, it thrives off sense of community. Using the community to build education and knowledge regarding a prominent issue like paediatric asthma would be beneficial in spreading knowledge and information. Nurses play a role in promoting families, schools, and local health organisations to create asthma-friendly environments across the community. Facilitating education sessions for the community creates collaboration between nurses and families, teachers, and health providers to create a support network. The second component of the Ottawa Charter is develop personal skills. Educating and especially gaining health education regarding relevant and prevalent issues is super important, especially in regional communities. Education empowers parents and children to be able to detect early symptoms, understand how to use an inhaler effectively, understand an action plan, and be able to follow it effectively. As a nurse, providing evidence-based knowledge that is tailored to a community's needs. This enhances self-management, reduces exacerbations and morbidities within the community. The two sustainable development goals that can be applied to paediatric asthma are Sustainable Development Goal 3 and 10. Sustainable Development Goal 3 looks at good health and well-being. It aims to promote healthy lives and well-being for all at all ages. Delivering education on asthma helps promote management and disease prevention. The main goal would be to reduce morbidity and mortality from non-communicable diseases like asthma. The best way to reduce it is through education and health promotion. If possible, you want to be able to educate communities regarding issues like asthma and educate them around the risk factors, triggers, and medication administration. Sustainable Development Goal 10 looks at reducing inequalities and promoting equality for everyone. Regional areas within Australia can often face inequalities regarding access to healthcare, specialised healthcare, and more. As a nurse, providing nurse-led education can help reduce disparities by making healthcare knowledge accessible for everyone. The aim of this is to ensure that vulnerable groups are educated and not left behind. Reducing those inequalities by making education and support more accessible is crucial. 2 registered nurse standards for practice are Standard 5, develop a plan for nursing practice, and Standard 2, engages in therapeutic and professional relationships. Standard 5 focuses on a nurse developing a plan that has clear aims, outcomes, and a follow-up session. With Standard 5, there's a real focus on structured goal-orientated education planning. Clear and goal-orientated planning can promote health and well-being within a community with a tailored education session. As a nurse, it's important to build therapeutic relationships. Building therapeutic relationships equals trust being built. If you're a trusted healthcare professional, you're more likely to be able to deliver a message or information and have that message delivered effectively. As a trusted healthcare professional, you can deliver culturally appropriate information, and by doing this, you can build confidence in the community to manage asthma. Nurse education is vital in regional communities to help fill gaps in knowledge and provide people with various management strategies for paediatric asthma. Targeting specific population groups like families and carers, you are likely to limit emergency presentations of asthma while strengthening community action and togetherness. The community resilience is super important when events like thunderstorm asthma occur, as education will be in place and support systems. Without education, there is an increased burden on the healthcare system, poorer health outcomes, and morbidity and mortality. Overall, it's important to consider various standards for health promotion and strategies when addressing paediatric asthma in the community. Ottawa Charter, Sustainable Development Goals, and Nurses Standards for Practice are useful for guiding and shaping education and help fix issues within a community. The first aim of the education session will to educate parents, schools, and carers around paediatric asthma. Educate these people around early warning signs of asthma and how to effectively treat an asthma attack. 4x4x4 method of asthma treatment for an asthma attack. The second aim of the education session would be to reduce morbidity within Bendigo relating to asthma. Promoting healthy habits and becoming aware of triggers to reduce morbidity, being prepared with treatment by educating the importance of having an asthma puffer with you during exercise, education of high pollinated periods, and the various asthma triggers that you can face and that can be presented around you. The overall aim of the session is that participants will be able to effectively follow an asthma action plan, understand early warning signs of asthma, and to be able to minimize asthma triggers. Learning outcome 1 is to implement strategies to minimize environmental triggers. The environment is a risk factor for asthma and often causes exacerbations. Pollen, tobacco, smoke, animals, and air pollution are environmental risk factors that should be avoided, whether that be within a school environment or at home. Learning outcome 2 is to properly educate families, carers, and school staff on effective medication administration. Minimizing medication errors and ensuring proper administration can effectively promote better treatment of asthma. The final learning outcome is to educate around the warning signs of asthma exacerbation. Ensure you understand the importance of an asthma action plan and how to follow it effectively. There are multiple resources required to ensure the session will be effective in promoting paediatric asthma care. 2 one-hour information sessions with a follow-up session 1 month post-session to consolidate learning and any concerns or issues. The materials required to ensure that the information is delivered effectively include visual aids like PowerPoints, printed asthma action plans, and asthma puffers plus inhalers to aid demonstration. Other materials required include information and fact sheets, evaluation forms, and local support services available to further support. When choosing human resources, it is important to consider who you are picking and think about who is trusted within the community and who is knowledgeable. In regional towns and cities, it's important to have trusted medical professionals to ensure people are willing to listen to the education that is being provided to them. Failure to not have trusted professionals delivering messages will lead to people who do not listen and do not take on board the message. The people required will be 2 nurses and 1 respiratory educator. Support staff from Asthma Australia or Bendigo Community Health Services will also be required. Having support staff and various health professionals from within the community is vital. Vital as there is already rapport and trust between the healthcare professional and the community. Evaluating sessions to gain feedback and understand the effectiveness of the session is vital. It is very important to understand if the session was effective for participants, if participants got the most out of it. If you don't gain this understanding of whether it was effective, what improvements could be made, further sessions won't improve and you won't be able to deliver what is required to be delivered. Some methods to evaluate would include a pre and post session quiz, skill demonstration, feedback surveys, and a follow-up evaluation. To know if the education session has been successful, it would first start with completing a pre and then a post test. The test will entail various questions regarding asthma, its presentation, common signs and symptoms, and various other components. Participants will take part in the test prior to having the education session and then after the education session. This would be to see if participants have improved their knowledge after the session. Another method to evaluate the success of a program would be to test participants' knowledge through skill demonstration. See after the session is complete, ask participants to set up a puffer with a spacer and see if they can effectively administer it. The setting up and administrating would be in line with the National Asthma Australian guidelines. Further evaluation of the session would include a survey post-program to determine participants' satisfaction and a follow-up evaluation session to determine if the knowledge has been attained and behavioural changes have occurred. In the follow-up, check in and determine if the asthma action plans have been implemented, if schools and communities have attempted to reduce triggers, and lastly, if there's been a reduction in asthma-related emergency admissions. With the feedback surveys, you can gain an insight into what people did and did not like about the session and if they want to provide any feedback regarding how the session was delivered. The ultimate test of a successful education session is a long-term impact. If the community of Bendigo can reduce morbidities, reduce asthma-related hospital admissions, and improve school attendance, it will highlight that the education session has managed to be successful. The goal is to educate, and by educating, you promote health and well-being in the community. Providing education to families, carers, and schools, we're hitting the first point in care and management. And if proper education can be provided, then asthma morbidities can be reduced. By using multiple evaluation methods, it ensures we are assessing both initial learning outcomes and long-term behavioural changes. This approach ensures best practice with health promotion and ensures accountability, evaluation, and overall improvement of the program being delivered. Thank you for watching my presentation on paediatric asthma. I hope I was able to educate you and provide you with a range of relevant information. Thank you again for watching.